Hi, this is Rachel Forrest. Today we'll be talking about emotionally focused therapy, or EFT. First, I wanted to talk about the history of the integrative experimental approach to treatment. It has elements of Carl Rogers' person-centered therapy, Gestalt therapy, experiential therapy, and existential therapy with attachment, interpersonal, psychodynamic and narrative theory, and a dialectical constructivist meta theory. It was originally termed process experiential psychotherapy and was used initially to underlying vulnerable emotions. There are two types of EFT models: emotion or emotionally focused couples therapy, known respectively as emotionally focused couple therapy by Sue Johnson and emotion focused couple therapy by Leslie Greenberg and Rhonda Goldman. It's important to notice the difference between these two because when it comes down to research, the slight similar differences can actually skew the results of the research or emotionally focused therapy in the research so the results are not skewed and are consistent. As you can see, by Sue Johnson is more of an attachment-based therapy. So it's attachment-related emotions and needs, and Leslie Greenberg and Rhonda Goldman are relationship. The types of EFT is there's EFT for couples or EFCT, EFIT, which is emotionally focused individual therapy, EFFT, which is emotionally focused family therapy. The goals in EFT for couples or EFCT is to expand and reorganize key emotional responses and in the process, the organization of self, actions, and patterns to foster the creation of a secure bond between partners. The goal of EFT for individuals is to offer corrective experiences that positively impact models of self and other and shape moments where vulnerability is encountered with balance to enable clients to move into the accessibility, openness, responsiveness, and full engagement that characterizes secure attachment with others, to enable clients to shape a coherent sense of a competent self that can deal with existential life issues and become a fully alive human being. The goals of EFT for families is to assessing this negative pattern, reframing family distress and child problems with relation blocks reinforcing this distress, promoting awareness and access to underlying caregiving intentions and disowned attachment-related needs, facilitating the sharing of unmet attachment needs and effective caregiving responses. The strengths of emotionally focused therapy is EFT is based on clear both health and dysfunction and of relationship distress and adult love. EFT is collaborative, respectful of clients, combining experiential Rogerian techniques with structural systematic interventions. Change strategies and interventions are specified. Key moves and moments in the change process have been mapped into 3 success at the end of therapy. EFT has been validated by over 30 years of empirical research. There's also research on the change processes and predictors of success. EFT has been applied to many different kinds of problems and populations. It's also good to note that generally EFT is a short-term therapy, so it is generally only 8 weeks long. There's also other key concepts. So we have 4 different emotion response types. In EFT, a distinction is made between 4 different emotion response types. We have primary adaptive emotion, which is person responds adaptively to information from the environment to enhance well-being and survival, such as feeling sad at loss and seeking comfort as a result. Maladaptive emotion is an origination in harmful dysfunctional environments, while adapted to that dysfunctional environment, it is not adaptive to other environments. Secondary reactive emotion is learned responses for when primary responses are not acceptable. And instrumental emotion is acquired through negative responses and experiences and are a way to control and manipulate the emotions of others. Other important concepts are emotion schemes provide the building blocks of self-organizations. When positive, it allows us to process and regulate our emotions and feelings effectively, allowing us to flourish. However, when negative, our emotional processing and regulation capacity is reduced, leading to more dysfunctional ways of coping. The differentiation of self and others is an important concept within this type of therapy. The EFT process is a trans-diagnostic case conceptualization of a moment-to-moment emotional processing in a session. The quality of their self-organizations, their understanding of their life histories, and the extent to which they are goal-directed active agents with adequate levels of differentiation between self and others. Use clients' pain as revealed in their life stories and in their in-session behaviors to guide their formulation moment to moment and over the course of treatment to transform emotion schemes which open up new ways of perceiving, experiencing, and behaving, allowing clients to transform their pain and develop more satisfying ways of being that allow them to thrive. The therapist client markers is to try to identify clients' problematic emotion schemes, listen for unmet core needs, attend to clients' expression of secondary emotions and interruptions to emotional processing, as well as broader themes that reveal clients' more characteristic ways of being in the world. Emotional processing is a key process in this type of therapy. The EFT methods is listening to client stories, empty chair dialogue, and then we also have focusing as in seen in this EFT tapping here in the right-hand corner. You focus from outward to the center of their bodies, focusing on what they are aware of, sensations, thoughts, feelings. And then you identify one issue or sense to focus on. And then you find a label or description that fits with their bodily experience. So this is focusing is important for people that have trouble identifying their emotions. Another method is systematic evocative unfolding, which client tells story in detail and therapist tracks when the emotion was triggered. So it would be like when a client tells a story in extreme detail and the therapist is going to listen for when it feels like the client was triggered within that story. Another key intervention is EFT tango of mirroring present process, affect assembly, and deepening, choreographing engaged encounters, processing the encounter, and integrating and validating. How the client is viewed and how change occurs. Therapists apply different techniques to facilitate clients' access to emotion, resolve problematic aspects of experience in terms of their self-organizations, shift how they interact with others, and refine their understanding of themselves and events. Following a therapeutic relationship as described by Carl Rogers, they are attentive, curious, accepting, and fully immersed in their interactions and moment to moment with their clients. Being genuine does not mean that the therapists reveal all their feelings to their clients, but rather they are aware of their feelings and do not pretend or deny them to themselves. 3 guides to emotional processing in this session are the awareness, transformation, and regulation of emotion. Using empathic reflections or response modes, and alliance repair dialogues, self-soothing dialogues, and narrative expression tasks. Alliance rupture dialogues are actively to reflect the client's reluctance, resistance, withdrawal, or hostility, and actively listen and validate what their clients are sharing. Self-soothing can be used with the empty chair and is seen commonly with the empty chair. Narrative expression tasks include markers that include shifts in narrative or highlights of life stories, and micro markers that indicate engagement in therapy. So the first marker would be noticing the shift in narrative with the life stories of the client. And the micro markers would be more for the client's use of indicating the engagement of the client within therapy in their notes. The population best served is used for depression, anxiety, complex trauma, eating disorders, and personality disorders. It has been adapted and used with individuals, families, and couples. And then it's important to note that remember that it was primarily EFT was used for couples therapy, but now has for families, individuals, and couples, using more of an attachment-based model, so strengthening our attachment bonds. This is our neuroscience research. There's a lot of neuroscience research regarding emotionally focused therapy, and generally it has pretty clear results. This particular type of research here in this one is colleagues argued that proximity to social resources regulates negative affect by buffering the perception of threat. They use functional magnetic resonance imaging. Women in the highest quality relationships showed strongly diminished threat-related activations throughout the brain, including the right anterior or insula, hypothalamus, and dorsolateral prefrontal cortex. The women in lower quality relationships did not realize the full regulatory impact of hand-holding and even had less regulatory activity attributable to holding hands with a stranger. However, facing threats of shock alone caused the highest level of threat-related brain activation. So whether they were in high-quality relationships with effective attachment or slightly lower quality relationships when it came down to attachment, the shock was buffered through hand-holding with a stranger or with their partner. But there was more shock buffered with a threat of shock with the higher quality relationship that had effective attachment. And these are my references. Okay, thank you very much. Hopefully we learned a lot about it. As you can tell from the presentation that there's a lot of similarities with other types of therapy, and you can see how there's different types of methods and techniques, as well as ideas that are borrowed from other types of therapy and used for this type of therapy. So it's interesting to see how there's different types of therapy that are using similar techniques as well as concepts.